Is my screen visible? Please mention in the chat box. So today's topic is water and electrolyte balance. Page number 215, chapter 11. Those who have the textbook, page number 215, chapter 11. So water, total body around 55 to 70%, almost around 60% of your total body weight is water. Okay. In a healthy person, 60 to 70% it is water. In obese people, the percentage of water is much lower, okay, around 45 to 60%. Obese males have low water percentage. In a healthy person, around 70%, 60 to 70% of the body weight comes from water. And how do we classify this water? It is intracellular fluid and extracellular fluid. Okay. Intracellular fluid, from the name itself, inside the cell. Okay, this is the water content that is found within the cells, any kind of cells. Okay, your blood cells, your bone cells, muscles, adipose tissue, anything. Okay, extracellular fluid is the fluid or water that is present outside the cell. Majority of it is interstitial fluid. Interstitial fluid means between two cells there is a space. Okay, very microscopic space between two cells. So that is interstitial fluid between two cells. Okay, lymph cells, GI fluid, spinal column fluid, tears, fluid that is present in your eyes. Okay, synovial fluid. They all are called interstitial fluid. So majority of the water is there as well. Then 8% of the water is found in blood plasma. Blood is liquid, okay, in state. Blood is liquid in state, and majority of that is because of the presence of water. This is how water is classified within your body. Intracellular fluid is the fluid that is present inside the cell that we have discussed just now. Extracellular fluid, you have plasma, fluid within your heart, in your blood vessels. Interstitial fluid, the cell, this is fluid that is found outside the cells. Okay. Fluid in dense connective tissues like cartilage and bones. There is water present in the skeletal structures as well. Okay. They are solid in state, but there is fluid present. Some amount of water is present even within the bone cells, between the bone cells. Transcellular fluid is the fluid that is formed, okay, like your saliva. This fluid is found, a lot of water is there in saliva as well, but saliva is formed in your salivary glands. Hormones are also fluid in nature. Hormones are formed in your endocrinal glands. Okay, enzymes are also fluid in nature. They are also secreted by certain membranes in fluid state. Okay, so this is how water is distributed throughout the body. Coming to the functions of water, it gives structure. Okay, If fluid was not there inside the cells would collapse. There would not be any structure. Okay. And water is important for all tissues, for growth, for its structure. Even the adipose tissue, fat tissue, that is also one-fifth water. Muscle also, three-fourths of muscle contains water. So that gives structure. That is important to give structure. It provides turgor. Okay. So that fullness in the tissue. When you are dehydrated, your tissues begin to collapse. It shrinks, okay, in size. But when water is present, they are fuller in their appearance. That is turgor. Okay. When you remove water, it will shrink. It will become wrinkly. And it is a solvent, especially for all the minerals and electrolytes. Water is considered as a universal solvent. Okay. A lot of metabolic reactions within your body takes place because a lot of minerals and electrolytes get dissolved in water, and even certain vitamins, vitamin B complexes, vitamin C, they dissolve in water. So that's why it's a solvent. It acts as a solvent. Reactant. Water also participates in a different variety of reactions within the body. Okay, and as a result of that, it donates hydrogen ions, it takes hydrogen ions, it donates oxygen ions because water is H2O. Okay, it has two hydrogen ions and one oxygen ion. Okay, so it donates, takes, attaches these hydrogen ions to other compounds, creating a new reaction. Okay, so hydrogen atoms get donated in form of hydrogen ions. Oxygen atoms also get donated. So that's how it reacts. It reacts with compounds. It is readily giving away its hydrogen and oxygen ion so that new compounds can be created. It's a lubricant. You can imagine if water content was not adequate in your saliva will not lubricate your food enough. Okay. If you're dehydrated, you will not produce enough saliva. You will not produce enough digestive enzymes. So water-based fluids, all the fluids within your body which are water-based, that will act as lubricant, especially in synovial joints and all. Synovial fluid in synovial joints, that is also made up of majority of water. Okay, if that content was not there, it will be very harsh for the joints to move around. Then it regulates body temperature through sweating and all. It distributes heat evenly in the body because water is a good conductor of heat and electricity. Okay, so in one part of the cell, if it is getting heated up, the water contents from that will distribute the heat equally throughout. Okay, so for maintaining the temperature also, water is very important. Then it provides dietary minerals. Usually it is fluorine. Okay, majority of the fluorine content you will get from water, iodine, zinc, copper, magnesium, sodium, based on where you are staying. Okay, and what kind of water treatment facilities you have nearby. Based on that, these minerals, you will get these dietary minerals from water. But the actual amount actually depends on the source of water where you are present. Other function, it will help mineralization of organic compounds. It will dissolve a lot of minerals and other chemicals so that other parts of your body can absorb it. It can also wash away a lot of toxic chemicals like lead, cadmium, pesticides, herbicides. These are the major functions of water. So, how much water should you drink in a day based on your weight? Okay. So, there is a chart given here based on your body weight, how much water intake should be there. Okay. Or you can also calculate this as every 20 kg of body, for every 20 kg of body, you should have at least 1 liter of water. Okay. If you want to take a screenshot of this chart, you can take it for your future reference to help somebody else out with this information based on their weight. Sources of water, your drinking water that you get, tap water, drinking water, RO water that you filter in your home. Okay. From food and beverages also you get water. Soup, when you drink soup and all, okay, it is mainly made up of water. Dal, soup, curries. Okay. No, this is for adults. Okay. The weight chart I have given, that is for adults. For children, just go to page number 219. There is a table 11.1. Okay. There for their children and for teenagers, how much water and the intake they should have is given. Okay. That is from the ICMR table. You can follow that. Okay. What I have shown, the chart that I have shown you, that is only for adults. Okay. If you want to reference that for kids, there is a chart given in the textbook. You can go back to that chart. Okay. Gender wise, it is specifically mentioned. So through food and even solid food, boiled rice, okay, that is solid food. That will also give you water. Okay. Very few amount, but even chapatis also they have water. Then the third type of source is your metabolic water. So your body also produces very less, but still it produces water as a byproduct of a lot of reactions. Okay. In addition to carbon dioxide and energy, water is also a product of the combustion reaction that takes place in your body. Combustion means burning. When you burn calories, okay, oxidation that takes place in your body, any oxidative reaction that takes place in your body, carbon dioxide, energy, and a small amount of water is a byproduct. Okay. So this water that your body has produced after producing, along with producing energy, okay, that water is called metabolic water. Water content in different food is also given on table 11.2, page 220. You can refer that as well. Even egg has water content. Okay, in gram they have mentioned it. Water balance, intake and output. based on that, we find out our water balance. Okay. So what is the intake of water? From fluids that we drink, water that is present in the food, metabolic water that is produced in your body. These are the water that comes into you. Okay. How do you lose water? Majority of it you will lose through urination. If it's a hot climate, it's a humid, hot atmosphere that you're living in. Through sweat, also you will lose water, and also through defecation, fecal loss. Okay, through that also you lose water. So that is the balance between intake and output. Usually for kidney patients, we heavily rely on this water balance to calculate how much water they are supposed to take. Okay, in the previous 24 hours, how much was their output? Okay, plus 500 ml or plus one liter, something like that. Calculation is done based on the condition of the kidney patient. Okay, so if they had an output of urine output, we can't calculate the sweat and fecal loss. Urine output is usually calculated in kidney patients. Okay, in the past 24 hours, what was their urine output? Based on that, water intake is calculated. So, how does the body knows to create this water balance? We have our thirst mechanism. Okay, the intake of fluid is largely regulated by our thirst mechanism. The third thirst mechanism, it starts in your brain. It affects your throat. Okay, and your salivary glands. These are the main areas that are involved in this thirst mechanism. So when the body fluid levels drop, okay, the brain knows to send the signal of thirst mechanism to your throat, your tongue, and your salivary glands. And that makes you feel thirsty. Okay. And you drink water to create the water balance, to overcome the loss. When you are dehydrated, usually dehydrated cells in your body, it will stimulate the thirst mechanism. And there are sensory nerves in your mouth, your pharynx, that is your throat. Okay, and it will respond to this dryness of mouth and pharynx. That is what we identify as thirst mechanism. Your mouth and your throat will get dry. Okay, so that is a response to the dehydration of cells in your body. Kidneys, how they create the water balance. There is internal circulation of salts. Okay, kidneys will not throw out everything that comes to it. It does reabsorption as well. So when you are dehydrated, your kidneys will try to reabsorb the water from urine back into your body. Okay, in the renal tubules, this reabsorption takes place, where along with water content, electrolytes as well will be taken back by the kidneys instead of throwing them out. It's said that in every 2 hours in a healthy individual, around 2000, 25,000 milliequivalent of sodium is filtered out and it is reabsorbed back. Okay, so if sodium has to be reabsorbed, water has to be present there to push it into the cells. Okay, and when there is this small rise in the blood osmolality, because a lot of electrolytes has been sent back from the kidneys into the bodies. Okay, it will create it will change the osmolality levels of your blood, and that change, okay, that will create the thirst mechanism. So pituitary gland present in your inside your brain, okay, that will send out messages which will cause kidneys to minimize their urine production. Okay, so that maximum water is retained in the body. And there is also osmotic pressure in your system that also maintains the fluid balance. Okay, cells, if there are a lot of electrolytes outside the cell, water inside the cell will move out. Okay, if there's a lot of electrolytes and salts inside the cell, water around the extrastitial spaces and all, okay, interstitial spaces, that will move inside the cell to create the equilibrium, okay, to create the balance in osmotic pressure. Okay, from anywhere, from high concentration to low concentration. Okay, that is the movement of water. Inside the cells, if there is too much of water, some amount of water has to move out of it to create the balance. That is high concentration to low concentration. Then edema is swelling. Okay, especially when there is too much of water in the extracellular fluid region, interstitial space, okay, the space between two cells and all, between the cells, if there is too much of water present there, that is what we call as edema or swelling. It leads to swelling. And also too much of sodium content can also lead to swelling. So when you have swelling, it's ideally said that you have to reduce your sodium intake, so certain amount of water can be released and pushed out of the body. Diuretics can also be used. Diuretics also use the same mechanism of pushing the water out of the interstitial space, push it into the plasma, okay, and filter it out and urinate it out into the environment. So creating balance within the body. Dehydration. So that is a condition characterized by water depletion in the body. Okay, water sources has been depleted. Okay, it has been consumed up. It may be because of insufficient intake or excessive water loss, or even both. Okay, either you're not taking enough water, or even if you're taking enough water, you're losing a lot of water. That could lead to dehydration. There are two types of dehydration due to loss of water, either through sweating, diarrhea. Okay, you lost a lot of water, and the second type is due to deprivation of water. You are not getting enough water. You're not drinking enough water. Okay, and electrolytes. That leads to dehydration. Causes of dehydration: diarrhea, excessive vomiting, excessive sweating, okay, adrenocortical dysfunction, because adrenal glands will also ensures that through the renin hormone, it ensures that sodium along with water is reabsorbed back into the system. Okay, but if adrenal gland is not working properly, it will not secrete the renin hormone, Okay, and the kidneys will not know water should be put back into the body or should it be created into urine. Okay, so mostly it will create it into urine and there will be a lot of urination. Okay, kidney diseases as well, kidneys are not so efficient to reabsorb water back into the system, so excessive urination, it will lead to dehydration. Deficiency in ADH as well can lead to dehydration. Deficiency in any type of electrolytes, especially um, sodium, okay, that can also lead to dehydration. Water intoxication, the opposite of dehydration, too much of water, okay, water concentration within your body is too high. Okay, the cells will take in tremendous amount of water and it will burst open. Okay, cells will swell with water and it will eventually burst. So that is water intoxication. Okay, very rare situation, and it could lead to hyponatremia because everything is diluted. Too much of water in your body means everything, your blood, your electrolytes, everything is diluted. Okay, so you will feel the repercussions of that also. Hyponatremia, hypocalcemia. Okay, all these repercussions of deficiency in electrolytes you will feel. At the same time, the cells will swell and start bursting. Okay, that could lead to, that is a very fatal condition. That is water intoxication. Very rare condition, but it can happen. If your thirst mechanism is not working, even if you're well hydrated, you may still feel you're thirsty and you keep on drinking water. So the main electrolytes in the body fluid: sodium, chlorine, magnesium, calcium, potassium. Okay, these all electrolytes should be there in a balance along with water, because that's how your blood's pH level will be maintained. If any of these electrolytes, if they are on the higher or lower side, it can make your blood acidic or alkaline. Okay, that is not good for your tissues. These electrolytes, they also carry signals from the nerves to the muscles. They help in coordination. Okay. Electrolytes in detail we have discussed in the previous session. The same electrolytes they have mentioned here as well. That's why I'm not taking it, but in detail we have discussed in the previous class. Okay. So if you have any queries, you can mention in the chat box.